Good morning. This is Dr. Les Phillips, psychologist at Triangle Orthopedics Rehabilitation Medicine Department. In this video, I want to talk a little bit about the treatment with opioids within the context of the Rehabilitation Medicine Department. Again, I want to remind you I'm a psychologist, I'm not a medical doctor, but I do work closely with the physicians and physicians' assistants in the management of chronic pain, and sometimes the management of pain includes treatment with opioid analgesics. Now, what in the world are these? That's just a 50-cent name for narcotics or scheduled medications, and these are basically opiate derivatives or synthetic opiates. These are narcotic medications that are strong and potentially addictive. Some examples of these medications that you have probably heard of or maybe been treated with before are things like OxyContin, oxycodone, methadone, fentanyl. These medications, as I said, are potentially dangerous. So why would we use them? The answer is, in some cases, they can provide enough pain reduction over and above other medications and modalities to make it worthwhile to be considered for ongoing treatment. But in order to make that risk worthwhile, we have to be able to demonstrate that the use of these medications actually improves people's functioning. What we don't want to do is have people taking these strong, potentially addictive, potentially dangerous medications and have them lying around or sitting around being inactive, because we know at that point that those medications can actually make them worse, can make them more debilitated, more depressed, and can interact with their other health problems. What we do want to see is patients who are being treated with these kinds of medications are up and around and functioning at a much higher level than they would be if they weren't taking those medications. That's how we know they work. So, if you're being treated with these kinds of medications in the Rehabilitation Medicine Department, you'll be doing so in what's called an opiate agreement. An opiate agreement is a written agreement between you and your rehabilitation medicine provider or providers, and it specifies your obligations and responsibilities. And these include things like being prescribed pain medications only by that provider and no one else. Also, not taking any illicit drugs or using alcohol. Also, not taking any medications that were previously prescribed to you but are not current. In other words, medications that you may have still around in your medicine cabinet. It includes keeping a close guard on these medications because they're certainly at risk for being stolen. So you keep these medicines under lock and key and are accountable for them at all times. If the medications are lost or stolen, then the medications will not be refilled early. So the opiate agreement will specify all of those specifics in terms of your expectations. Also, you'll expect to have random urine drug screens as well as routine urine drug screens. Expect to have random pill counts. So if the provider calls you and says you need to come in for a pill count or a drug screen, you need to be able to do that. Again, the medications are lost and stolen, they will not be refilled early. So this is not an exhaustive explanation of the opiate agreement, but at least gives you a background on what to expect with this kind of treatment. Thank you.